Hey everyone, welcome to our channel. We're living in a digital age where AI is everywhere, even in healthcare. But can an AI really tackle the same complex medical questions I face every day as a doctor? Today, we're putting ChatGPT through its paces. No easy Google searches here, folks. We're talking about real-life medical scenarios that require critical thinking and a deep well of knowledge. We'll be throwing curveball diagnoses, tricky treatment plans, even ethical dilemmas its way. Is ChatGPT up to the task? Can it hang with a real-life doctor? Stick around to find out. Can an AI answer the same tough medical questions doctors face every day? Today, we're putting ChatGPT to the test, with challenging real-world medical questions that require more than just a Google search. Let's find out what this AI really knows, and where it falls short. Let's start with a case that landed on my desk recently. We've got a 55-year-old male, longtime smoker, coming in with complaints of coughing up blood. That's hemoptysis for you medical buffs, weight loss, and a nagging cough that just won't quit. We do a chest x-ray, and bam, there's a suspicious mass right in the center of his chest. Now, if you're thinking what I'm thinking, the big C-word lung cancer probably just flashed through your mind, and you wouldn't be wrong to think so. But as doctors, we can't jump to conclusions. We need to consider all possibilities. So let's see if ChatGPT can keep up with our medical brains and offer up some potential diagnoses. All right, ChatGPT, you're off to a decent start. It's identified the big three in this case: lung cancer, always a concern with smoking history; tuberculosis, especially with that cough; and bronchiectasis, a possibility with his long-term respiratory issues. Now, here's where it gets a little tricky. While ChatGPT correctly identified the potential culprits, it didn't quite nail the prioritization based on this patient's specific situation. Given his smoking history and that central mass on the X-ray, lung cancer should be at the top of the list. It's the most likely and potentially the most aggressive, so we need to rule that out first. That being said, for an AI, it's still pretty impressive. It's like having a super fast medical student on hand, spitting out differentials. But remember, folks, diagnosis is just the first step. For our next challenge, let's dive into the world of chronic disease management. Imagine this. A 42-year-old walks into your office just diagnosed with type 2 diabetes. They're struggling with their weight, their blood pressure is through the roof, and their A1C, that's a measure of long-term blood sugar control, is sitting at a not-so-healthy 9.5%. Now, I'm sure many of you are thinking, metformin, that's the go-to for diabetes. And you're right, it often is. But remember, medicine is not one size fits all. We need to consider the whole picture: the patient's individual needs, their lifestyle, and any other health conditions they're dealing with. So, let's see how ChatGPT handles this complex treatment puzzle. Okay, ChatGPT, you're on a roll. Not only did it recommend the gold standard metformin, but it also highlighted the importance of lifestyle changes, which is crucial for managing type 2 diabetes. Diet and exercise aren't just buzzwords, they're powerful tools for getting blood sugar under control. And here's where I'm really impressed. ChatGPT went a step further and brought up SGLT2 inhibitors and GLP-1 receptor agonists. These are newer classes of diabetes medications that have shown additional benefits, like heart protection, which is especially important for patients with hypertension like ours. This demonstrates a good understanding of current diabetes management guidelines, which emphasize individualized treatment and considering cardiovascular risk. Color me impressed. Now, let's crank up the difficulty level and throw a real medical curveball at ChatGPT. Picture this. A 26-year-old woman comes to you with a constellation of strange symptoms, recurring fevers that seem to come and go, painful ulcers in her mouth and even on her genitals, and to make matters worse, her eyes are inflamed. This, my friends, is where things get tricky. These symptoms could point to a whole bunch of different conditions, but to an experienced physician, they scream one thing: Behçet's disease. It's a rare autoimmune disorder that most people have never even heard of. So, can ChatGPT, with its vast but artificial intelligence, piece together this medical puzzle? Let's find out. I've got to hand it to ChatGPT. It actually nailed it. Behçet's disease is not exactly a household name, even in the medical community. It's not something you see every day, and diagnosing it requires connecting the dots between seemingly unrelated symptoms. The fact that ChatGPT was able to identify it as a possibility is a testament to the vast amount of medical data it's been trained on. But here's the catch. While ChatGPT successfully listed besets, would a regular person even know to ask about it? This highlights a crucial point. While AI can be a powerful tool for accessing medical information, it's still just that, a tool. It can't replace the expertise and judgment of a trained healthcare professional. If you found this fascinating, make sure to like, subscribe, and hit the notification bell for more intriguing cases and AI insights. Chapter 4. Dangerous duos. Can ChatGPT spot this drug interaction? Let's face it, we've all been there, staring at our pill organizer, wondering if it's safe to take certain medications together. Drug interactions are a serious concern, and even doctors like myself rely on resources to make sure we're not prescribing a potentially harmful combination. So, for this challenge, we're going to test ChatGPT's knowledge of drug interactions with a question I often get from patients. Can you take fluconazole, a common antifungal medication, with simvastatin, a cholesterol-lowering drug? ChatGPT hit the nail on the head. Not only did it correctly identify the potential for interaction, but it also highlighted the risk of rhabdomyolysis. This is a severe side effect that can cause muscle pain, weakness, and even kidney damage. And here's where ChatGPT goes above and beyond. It actually recommended an alternative statin, pravastatin, which has a lower risk of interaction with fluconazole. That's not just basic drug information. That's clinical decision-making support right there. This demonstrates a level of understanding that goes beyond simply regurgitating drug facts. It's applying that knowledge to provide practical and potentially life-saving advice. The ethics of AI. Can ChatGPT navigate this sensitive situation? Medicine isn't just about diagnosing diseases and prescribing pills. It's about navigating complex ethical dilemmas, especially when it comes to sensitive issues like reproductive health. So, let's see how ChatGPT handles a situation that often requires careful consideration and a deep understanding of both medical and legal guidelines. Imagine this. A 16-year-old girl walks into your office requesting birth control. She's clear about her wishes, but begs you not to tell her parents. This is a scenario fraught with ethical and legal landmines. Laws regarding minor consent for reproductive health services vary from state to state, and there's a lot to consider. So, how will ChatGPT, an AI with no emotions or personal biases, approach this delicate situation? You know what? I'm actually impressed by ChatGPT's response. It didn't just spit out a black and white answer. Instead, it acknowledged the ethical complexities, highlighting the importance of patient confidentiality while also recognizing the need to consider legal requirements regarding parental notification. It even went a step further by encouraging the user, presumably a healthcare provider, to consult local laws and guidelines. This is crucial because what's ethically sound might not always align perfectly with legal requirements, and vice versa. ChatGPT's response was cautious, well-worded, and emphasized the need for a nuanced approach. It didn't try to play judge and jury, which is exactly what you want in a situation like this. Chapter 6. AI Doctor versus Real Doctor, the final verdict. So, after putting ChatGPT through its paces with these challenging medical scenarios, what's the final verdict? Is it ready to hang up its stethoscope and start seeing patients on its own? Well, not quite. Let's be crystal clear. ChatGPT is not a doctor. It doesn't have the years of medical training, the hands-on experience, or the ability to truly connect with a patient on a human level, all of which are essential for providing compassionate and effective healthcare. However, and this is a big however, ChatGPT is surprisingly good at providing medically sound information. It's like having a super-powered medical textbook at your fingertips, capable of synthesizing complex information and presenting it in a way that's relatively easy to understand. For physicians like myself, it can be a valuable tool for double-checking information, exploring alternative treatment options, or even just staying up to date on the latest medical advancements. It's like having a brilliant, albeit digital colleague to bounce ideas off of. For patients, ChatGPT can be a great starting point for researching symptoms, understanding medical conditions, or getting a second opinion. But remember, it's crucial to take everything you read online with a grain of salt and always consult with a qualified healthcare professional for any health concerns. What do you think? Should doctors be incorporating AI tools like ChatGPT into their practice? Have you ever tried asking ChatGPT a tough medical question? Let me know in the comments below. And don't forget to like, subscribe, and ring that bell for more videos exploring the intersection of AI and healthcare. If you're still with us at the 10-minute mark, leave a comment with the word AIIHealth to let us know you're a true fan. Chapter 7. Outro. All right, everyone. That's it for today's deep dive into the world of AI and medicine. As you can see, things are changing rapidly, and it's an exciting time to be both a doctor and a patient. Remember, technology like ChatGPT has the potential to revolutionize the way we approach healthcare. But it's crucial to use it responsibly and ethically. It's all about finding the right balance between human expertise and artificial intelligence. I'm passionate about exploring the cutting edge of medicine and making sure you have the information you need to make informed decisions about your health. Until next time, stay curious, stay healthy, and keep those medical questions coming. So, what did we learn today? AI is getting crazy good, but it's not replacing your doctor anytime soon. And that's a good thing. We bring the human touch, the years of training, and the ability to really listen to you. Not just your symptoms, but your concerns, your fears, your hopes. AI can be a powerful tool, but it's just that, a tool. It's up to us, both doctors and patients, to use it wisely and ethically. Remember, knowledge is power. So stay informed, stay curious, and always advocate for your own health. This is your doctor, signing off for now. Make sure you hit that subscribe button and stay tuned for more videos exploring the ever-evolving world of health and medicine. See you next time.